Hello, my name is Keandra Patrick, and I'm in the RSBSN program at Queen's University of Charlotte. I'm doing my practice experience synthesis paper and presentation on meeting the National Patient Safety Goals. In 2002, the Joint Commission established the National Patient Safety Goal Program. The first set of National Patient Safety Goals was effective on January 1st, 2003. They were established to help accredited organizations address specific areas of the concerns in regards to patient safety. They also enforce major changes in patient safety. The quality of care and the safety of patients are the core values of Joint Commission accreditation process. The ultimate purpose of the Joint Commission accreditation process is to enhance quality of care and patient safety. The Joint Commission standards are the basis of an objective evaluation process that can help healthcare organizations measure, assess, and improve performances. Let's talk about the Joint Commission. It has specific goals for the following healthcare facilities, and they are the hospitals, home care, nursing care, office-based surgeries, behavioral care, critical access, hospital lab services, and long-term care. The national safety goals are aimed to prevent errors. So recent changes have focused on preventing hospitals acquired infections and medication errors, in addition to the existing goals, promoting surgical safety, correct patient identification communications between staff and identifying patients at risk for suicide. And they also have added alarm system to the national patient safety goals. I presently work in a behavioral health setting. The national patient goals was effective January the 1st, 2015, and it consists of improved accuracy in the identification of individuals served, improve the safety of using medication, reduce risk of healthcare associated infections, and identify safety risks for the population served. So besides this, before this assignment, I was not aware of the Behavior Care National Patient Safety Goals. I believe each facility should educate their staff about Joint Commission standards and goals. The staff must be educated on the standards and goals for the safety of the patient and to be within regulation of Joint Commission. I have always heard the director say, Joint Commission is coming, Joint Commission is coming. No one ever in service the nursing staff on what to do, what the standards and goals of the Joint Commission consist of. The Joint Commission pages say safety reports the patient safety is defined by the World Health Organization as the prevention of errors and adverse effects of the patient associated with health care. So we have to keep that in mind, patient safety at all times. So when we talk about the patient safety system, is to provide healthcare organizations with a proactive approach to design or redesign a patient-centered system that aims to improve quality of care and patient safety, which aligns with the Joint Commission and standards. The Joint Commission partners with the accredited healthcare organization to improve healthcare systems to provide to patients and protect them. The first obligation of healthcare is to do no harm. Proactive risk, reduce and prevent harm before it reaches the patient. And that's our main and final goal, is to protect the patient. When we talk about system thinking is the ability to recognize, understand, and synthesize the interaction and interdependencies in a set of components designed for a specific purpose. Real change tends to start with organization structure, goals, missions, and visions, which are typically established by the board of directors, senior leadership. This should be the beginning stage of educating staff about Joint Commission specific goals for the facility. Education should start upon hiring. And the key is system thinking. The quality and safety education for nurses initiation was developed to integrate quality and safety competencies into nursing education to accelerate change. Regulatory agencies have implemented the National Patient Safety Goals and core measures to ensure safety. The full effect of the QSEN competencies to improve the quality and safety of care can only be realized when the nurses apply them both the individual and the system care. Knowledge and skills associated with system care are seldom addressed in basic or continuing education. It is believed that the personal expertise of the nurse, individual patient is necessary. The quality system of care requires that the healthcare profession improve the wider system of care. If I have said that and you still don't understand what I said, you may understand the next slide. So this is an example of system care. Like you go in there and you say, okay, I'm going to turn my patient. She have ulcers. I'm going to turn her left, right, and on her back. But the system thinking thinks more in depth. It said, I will compare our unit ulcer rate with the benchmark. So you're just not going to go in there and turn her. You're going to do some system thinking, which, what did I say? It's the ability to recognize and understand and synthesize the interaction. So you're not just going to go in there and turn her. You're going to measure the ulcer rate with the benchmarks and compare them. That is system thinking. I think that's great. Okay, we're going to talk about the use of Magnet Status. Their program improve patient safety and quality outcomes. These programs include educational initiatives that both increase the numbers of nurses with BSN degrees and specialty certificates. Having nurses on staff with BSN degrees will increase the quality of care and safety for the patient. It will also help meet the National Patient Safety Goals established by Joint Commission. A culture of safety has been enhanced by the involvement of the staff nurse in the process of which our professional nursing practice standards are developed, implemented, and monitored for the impact of the patient care. According to the IOM, nurses with bachelor's degrees possess the skills, knowledge, and ability to manage and increase the complexity of both patient and healthcare systems. By 2020, 80% of the nurses should be having their BSN degrees. Patient safety is first. So we're going to talk about patient safety strategies which could help meet patient safety goals. So if we strategize, we probably can help meet the National Patient Safety Goals. The patient safety strategies promote a culture of patient safety, which may include a single intervention or several interventions, and they even may combine. Some strategies consist of walk around and team training. Walk around aims to show leadership and commitment to safety. Team training promotes a safe culture. It is essential to develop a culture of safety. So our interventions and plans for improvement is to educate the staff. Upon hiring the staff, they should provide information about the National Patient Safety Goals and that's pertaining to their facilities. They should give frequent training about Joint Commission standards, goals, and any new information reported. They can align existing Joint Commission standards with the daily work that they do in order to engage patients and the staff in the healthcare system. Healthcare organizations can also be assisted with advanced knowledge and skills and competency of the staff and the patients by recommending methods that will improve quality of care and safety. Another plan is to improve the Magnet Status. It could be proven that the BSN degree nurse provided better quality of care and safety that may help with their education, help meet the National Patient Safety Goals, and stay within regulations of Joint Commission. You see, I have caution about the progression of this paper. I had to proceed with caution. The progression of this paper started out real slow. I have had difficulty finding information that was needed, and I also had obstacles to find enough of the information for 7 pages of information. But hopefully I gathered enough of the sources that I need to finish this paper and provide you with the great knowledge that you deserve. So I went for the nursing theory. I went with Mr. Gene Watson, the philosophy and science of caring. So I chose Ms. Gene Watson. This nursing model states that the nurses is concerned with promoting health, prevent illness, caring for the sick, and restoring health. Change can occur by educating the nursing staff on Joint Commission standards, goals, and how to meet the National Patient Safety Goals. The goals were revised January the 1st, 2015. Before now, I was not aware of it, but due to this assignment, that I'm fully aware of what the goals are. And once you are educated, you can adhere to the goals, and you can promote health, prevent illness, and caring for the sick to restore health. So when you are promoting safety and keeping the patient safe, you are promoting health and preventing illness and caring for the sick. So once the nurse staff is educated on that, they will be able to meet the goals and adhere to the standards with knowledge and understanding. When dealing with promoting health, preventing illness, caring for the sick, and restoring health, BSN degree nurses are educated and can critically think better to ensure patient safety. So when I look at the change model evaluation, I say it has been proven that change model evaluation is effective when staff is trained to do no harm. Staff should be educated on Joint Commission and Joint Commission standards, and when they are fully educated on the National Patient Safety Law goals, they will follow the Joint Commission Patient Safety System, which can also help with meeting the National Patient Safety Goals. To achieve the best outcome, patient and family must be more active, and we have to be proactive. So to engage in decisions about their health, and must have broader access to information and support. So with all that said, I want y'all to know that y'all need to keep calm, and Joint Commission is coming. Here's some resources, and I hope you enjoyed my presentation. Thank you.